And welcome back to the Kiosk Presents. Our guest right now is nationally recognized plastic surgeon, Dr. Stephen Dayan. Welcome to the Kiosk Presents, Doctor.
Thank you. It's nice to be here.
Thank you. So, Doctor, nowadays, when you're out and about, whether you're with friends or with family, and it could be at work or out at the mall or out at the skating rink, but people today are always taking pictures and posting them online, and sometimes we kind of look at ourselves and go, we don't look the way we used to. So. I think so. You're the guy, I guess, that we can talk to a little bit about getting rid of lines and wrinkles and trying to get back to a more of ourselves, so to speak.
Absolutely. It is quite amazing with these smartphones today. Everyone's always taking pictures of themselves. My kids always have the phone up taking photographs of themselves. So yes, we are seeing ourselves in photographs so much more often. Think of how many times your picture shows up from Facebook to Instagram to LinkedIn. Everyone's looking at it.
Right.
So how you look is important. And this time of year in particular, many people are coming to us asking for treatments because they know that a lot of photographs are going to be taken, but also it's holiday time. They're going to see family members. There's going to be reunions. You're going to see friends. So what can you do? And one of the most common treatments, or the most commonly requested treatment, is to treat the lines and wrinkles around the eyes. In particular, the glabellar, or the 11s between the eyebrows, is an area we treat, and that's what we've been using Botox cosmetic for since 2002. And that's a very common, safe treatment for us. But recently, we just got FDA approval, so we're very excited for treating the crow's feet area, or the fine lines around the eyes. And that's the second area which we commonly treat to reduce the appearance of those lines and wrinkles.
Sure. So, like, once you start seeing wrinkles on your face, is it too late to do anything, or because of these treatments, can you actually now do something about it?
No, it's not. It's never too late to really treat these areas. Whenever you're ready to treat it, that's probably the appropriate time. Now, most people don't see these lines and wrinkles forming until their late 30s, so that's when we start to see people coming in for the first time. And we believe today that if you continue to make certain motions, like frowning or squinting your eyes, that will promote and cause these wrinkles to be more long-standing and maybe even permanent. So if we can start today using Botox early, we may be able to prevent the appearance of those wrinkles. Now, we haven't proven that in a long-term study, but clearly we can, at that time, within the next 3 or 4 days, reduce the severity of those lines and wrinkles and give someone a more rejuvenated appearance.
So it is true then that laughing, smiling, frowning do contribute to lines and wrinkles on your face?
Well, we believe so. Empirically, it seems to make sense, and we have some evidence to show that continuous motions do cause more long-standing wrinkles. But I think it's important to keep in mind that when you undergo these treatments, that you see someone who's very experienced, because you want it to be done well, because some animation is good. We don't want to take away all of someone's expression or emotions. That won't look right. So when it's done by someone who's board certified, who has a lot of experience in this area, then you're more likely to get a fantastic outcome.
So when you're treating a patient that comes to you and says, I want to do something about these lines and wrinkles, do you sort of assess in your own mind how subtle you want to make the changes?
That's a fantastic question. And the answer is yes, wholeheartedly yes. It's about the subtle changes. That's where the best improvement comes from. I really believe that if you can see a change have been done, if you can recognize a difference, then it wasn't done well. The changes have to be subtle enough that the unknowing observer can't tell that you had something done. They just think you look a little bit better, and they're not entirely sure why you look better. But that's up to the doctor with his artistic or her artistic talent in conjunction with the patient to come up with a result that best meets both of their ideals.
Right. So the ideal situation is, once you have this done, is for when people that know you say, "Wow, you still look great after all these years."
I so strongly believe that. I've written a book on this concept because I think that is so critically important, because once you can tell someone had something done, whether it's a comb over, too much makeup, or bad plastic surgery, the minute that's been done, it defeats the whole purpose of going through the treatment in the first place. People look worse.
Right. You're absolutely right. And I think there's a few. I think you notice it more so on people that are in the media a lot, celebrities, whether it's athletes or actors, actresses. I think really you can kind of look and say, wow, they had some work done. Where more ideally, I think you'd like to say, wow, they look fantastic.
Yes, and every time a celebrity comes on who's been overdone, it hurts our business. None of us like seeing that. It's not what we do. We don't make people look better. We make them feel better. And it's a big difference. And the subtle change is what does it.
Right, right. So what's sort of on the horizon? That's sort of in the pipeline here in terms of some other treatments that might be available either near term or sometime shortly down the road.
Well, there's a lot of exciting advancement coming. In the next 2 years or so, you're going to see a lot of new products come to market that we're really excited about, and they're all going through rigorous testing right now. But having just completed that rigorous testing and having just gotten FDA approval is Voluma, which we're pretty excited about also. And that's a filler agent that goes deeper down to the cheeks and fills in the hollows and folds that tend to occur as we age. And that lasts up to 2 years. So we're pretty excited about having that new product to offer to our patients.
And so, with something like this here, once you're treated, in say 5-10 years down the road, many of these treatments can be done again.
Yes. For Botox Cosmetic, it lasts approximately about 3 months. So some people come in every 3 months, but that's not too usual. Other people come in once a year, whatever works best for them. With some of the newer filler products that last up to 2 years, that's quite impressive. So you may be happy for the next 2 years, then you can come back after that if you want more.
Wow. Well, listen. Well, doctor, it's been great, and I'm glad to know that there's still hope for me yet. So that's wonderful.
Well, yeah, there's plenty of hope for a lot of us.
So, doctor, where can the folks at home go for more info?
So the easiest thing to do is go to BotoxCosmetic.com.
BotoxCosmetics.com. Wonderful, wonderful. Well, doctor, thank you so much for joining us today on the Kiosk Presents, and we hope you have a great holiday season.
You too.